There's a huge unmet need for patients, well, with all our cancers, but there's a huge unmet need, particularly once you get beyond first-line colorectal cancer, and particularly when you get beyond second-line colorectal cancer. There's an interesting trial that will be presented at this meeting with TAS-102 plus bevacizumab, which improves things, but let's face it, compared to many other malignancies, people who are in the third-line space with metastatic colorectal cancer have relatively few options, and overall survival is short, even in these trials, less than a year. So, the problem is that the IO revolution has not really reached most people with colorectal cancer. So roughly 3 to 5% of patients have MSI high or deficient DNA mismatch repair. They often, though not always, do really well with immunotherapies, but in general, the vast majority, 97% or so of colorectal cancers who do not have deficient DNA mismatch repair, sometimes called MSS, those patients really have very few options, particularly from an immunologic standpoint. So there are a number of actually very interesting, including data that will be presented here, but there have been a number of trials, small trials, of dirty tyrosine kinase inhibitors that hit a number of different receptors that may be important in the immune space, in combinations with checkpoint inhibitors. We know that checkpoint inhibitors, whether PD-1, PD-L1, CTLA-4, the classical ones, really have had very limited benefit in this group of patients. There have been several trials, small trials, with other tyrosine kinase inhibitors showing, I would say, some hints of benefit, and a very similar drug to this one, which is XL092, a very similar drug, which is cabozantinib. That combination with a checkpoint inhibitor also has shown some encouraging activity. So that's the rationale, which is that a drug that has been engineered to be have some better pharmacokinetics than cabozantinib. We have this interesting, small series data, and it's going into a larger trial to look at it.